Now, when a child starts from birth up to 5 years, that is the most critical part of the person's life. That is the time that the baby's brain will develop to its optimum. If you don't get that optimum,
low rates in exclusive breastfeeding continuation among professional working mothers, the lack of improved policies on maternity leaves, as well as the unavailability of friendly breastfeeding environments in most institutions are some of the challenges affecting the breastfeeding patterns of some working mothers. However, to accelerate the progress towards the attainment of the SDG 3 of ensuring a healthy life for all by the year 2030, the Western Regional Health Directorate is still coming up with innovative policies that include extensive public education to improve on the breastfeeding and weaning practices of mothers. Western Regional Public Health Nutritionist Isaac Baba Anagi.
Western region, is a very commercial region, one, and so you have a lot of breastfeeding working mothers, and that is one reason why our rates are quite low compared to other parts of the country. And so we need to intensify that information on expressing the breast milk so that working mothers can successfully breastfeed. I think if mothers know that they can express the breast milk and then store it and feed their babies, that will improve or help us. Another factor we have realized also is the pressure from the grandmothers and the in-laws. That factor is also very prominent in the reasons that mothers give for not exclusive breastfeeding, especially when there is small delay in the breast milk setting or establishing the lactation following delivery. Then there is that pressure from in-laws and other members of the family to give other things besides breast milk. But
in 2011, 48.8% of infant and young children in the region were exclusively breastfed, but the 2017 data showed 22.2%, a decline. Fast forward to 2021, however, there was an increase in early initiation of breastfeeding from 51% to 60%. These and other factors encouraged the observation of the World Breastfeeding Week to highlight the importance of especially the 3-month exclusive breastfeeding. For this year's celebration, the Western Regional Health Directorate will galvanize support from stakeholders to intensify education on exclusive breastfeeding at health facilities, churches, mosques, and other areas including market centers. At a day's media engagement on Start Right, Feed Right from Birth to 2 Years campaign by the Ghana Health Service, the Deputy Director of Public Health, Dr. Gifty Amugi, cautioned mothers to ensure proper feeding of children from birth till 5 years, as that period is most critical part of their lives.
We need to be recording 90-95% and above for exclusive breastfeeding. So as part of the Start Right, Feed Right from birth to 2 years intervention that we are revamping, we're going to go around all districts, all communities, all facilities, and enhance or improve, increase, reinforce the same message we've been giving to these mothers and even to be mothers, that is those at ANC and all, so that when the person gives birth, he has the right knowledge and will act right. So as a region, we will continue at this time in a more reinforced way, so that we see that by the end of 2023, we would have gotten a better performance than what we have now. And we would see that when we start begin to also map that to how many of the children or the proportion of children that were malnourished, we'll see that it will begin to decrease more.
As at the end of 2022, 48% of mothers had practiced exclusive breastfeeding. This figure, according to the Regional Public Health Office, needs to be improved further.
My mom actually made me practice an exclusive breastfeeding for all my 3 kids. So I've never regretted practicing the exclusive breastfeeding. My kids are very smart. I don't have to spend money on feeding, and also they look very healthy.
From the Western region, my name is Isaac Hughes, reporting for Asasi Radio.